Oh, look at that before and after. Dr. Scott Thompson joining us now from Utah Facial Plastics. This is my favorite plastic surgeon. I only trust my face to Dr. Thompson. And a lot of people out there trusting, including kids, their ears to you. There's something called otoplasty. What is that?
Otoplasty is just simply moving the ear back, and it's a fairly common problem that people have where we're missing this fold right here. If you don't have this fold, the ear will kind of cup forward. And there's a very simple procedure that we can do where we just move the ear back, and you can see in that picture there's no fold, and then in the one on the right side there is a fold.
And that's genetic?
It's genetic, yeah. It's just the way you're born, and a lot of times people tell me, you know, their kids are born that way and they think they're going to grow out of it. The head does grow, but it usually doesn't fix itself. It's usually something that has to be
So what is the procedure like? What do you do in that case?
We simply make an incision on the back of the ear, and then we go in and place some permanent stitches to create that fold, to kind of fold the ear back, and then usually we'll pull the whole ear back a little bit. And it's a relatively simple procedure. It works every time. It's one of those things that's just got a really high satisfaction rate and very low complication rate.
It's been called
something I love to do.
Pinning, right? Before,
yeah,
and
yeah.
That's what you're basically doing, is pinning that fold back.
Some people know it as ear pinning. Sometimes that's the way people ask me about it. So,
are you under anesthesia for this?
As long as you're over about age 10, it doesn't require anesthesia. I can just simply place a few injections behind the ear, numb the whole ear up, and then we can do it under local. You're awake for the whole thing, and that's always easier than going to the hospital or going under anesthesia. Saves a lot of money to do it that way too. But if it's someone that doesn't want to do that, or they're a little scared of needles, or they're younger, then we can put them to sleep.
You just said to me this is one of your favorite procedures to do. Why?
It's one of my favorites because it just makes such an immediate big difference, and there's literally usually no bruising, little downtime, little pain, very safe, very low complication rate. And you know, I've done this in kids as young as 5 or 6 all the way up into the 70s at times. So
you're showing a before and after here, and look at her. You could tell she's grown her hair out.
Yeah.
Because I'm sure that's how you feel.
Yeah, for women,
you hide it with
they
your hair.
never want to pull their hair back,
right.
and they're always bothered. I do a lot of dancers, and I can never pull my hair back because my ears stick out, or guys will grow their hair long because they want to cover up their ears, and then that just takes that out of the equation.
Well, imagine what this does, this little procedure for self-confidence. What are you noticing after?
I think it's huge. I mean, I just saw a kid the other day, and I just said, you know, how are you feeling about this? And he said, I absolutely love it, but I don't even think about my ears anymore. Before it was a constant thought when I looked in the mirror, when I took a picture. Now I just don't think about it anymore. So I think that's what it does for people.
So you said kids, and we also saw those photos of adults. Are you doing one more than the other?
Probably more often kids, usually the 10 to 15 age category, but I've done several. Like I just a couple months ago, I had a man in his 70s, and he was feeling all guilty, like I shouldn't be doing this for myself, but he just had a huge smile on his face when he came back, and he said, I did this for me. I've been teased about this my whole life, and it made a huge difference for him. So that's why I like to do it.
If you're a parent out there and you're saying, all right, my child's 3 or 5 or 7, how do you know what the right age is to come in?
Typically, we recommend that it be done at about age 6 or 7, and that's for a couple of reasons. The ears are usually done growing by that time, and then also, if possible, we like to do a surgery on someone that wants to have it done. And so if it's a 4-year-old, they're probably not really thinking about their ears. But by the time they get to be 6 or 7, a lot of times they're asking their parents about it, and they want to have it done. And that makes the whole process easier.
They've noticed they're different.
Right.
And they're noticing it.
Yeah.
If people have a question, again, it is called otoplasty.
Right.
So call the office or go to their website, utahfacialplastics.com. That's it right there. Look at that cute little kid that says, I love my ears now. Yeah, go to our website. We'll link you, everybody. Good Things Utah. And we'll link you to Dr. Scott Thompson. Has several different locations, and he's just such a nice guy. It's good to have you on the show.
So happy to be here today.
Good to see you.
Nicea.
Devin, over to you.
Yeah, I'm going to say something here that I had